Cansayapi. We have a public service announcement for you. Today is May 7th, 2020 with the COVID-19 update. Potential exposure in the Lower Sioux Indian community. The Lower Sioux Indian community in the state of Minnesota's Emergency Operations Center received voluntary notification of a potential exposure risk in the community this previous weekend. Those individuals that were potentially exposed were notified by Health and Human Services and are voluntarily self-isolating in their homes. As part of our community response model, these individuals will be receiving daily phone calls from the community health nurse to monitor for symptoms, from human service representatives calling every 3 days to ensure their basic needs are being met and to offer support. The CDC recommends individuals who have potentially been exposed to monitor for symptoms. Those who were potentially exposed will be monitoring symptoms and reporting to the community health nurse if any symptoms become present. We encourage each of you to take care of one another and call the EOC if you believe you have been exposed to COVID-19. The individuals who believe to have been possibly exposed are leading by example by following community and CDC guidance, self-isolating, and monitoring symptoms. Please respect the privacy of those who are self-isolating in coordination with this potential exposure. Details about all COVID-19 cases are confidential. The EOC and EOC support staff maintains the confidentiality of all individuals who call the hotline. The EOC appreciates self-reporting and is here to assist any individual voluntarily self-isolating due to COVID-19 exposure or infection. There is no shame in reporting exposure or infection. We're all at risk anytime we leave our homes. The number of COVID-19 cases continues to grow across Minnesota and the United States. Social distancing is the only way to effectively slow down the rate of infection. Therefore, all of us need to be good relatives and continue to stay home unless it's absolutely necessary to leave based on those essential services outlined in the community's amended shelter-in-place order. If you have any questions or concerns, please call our EOC hotline at 320-522-0216. So, yes, I am one of them that was potentially exposed third hand. So I wanted to get this message out as best we could to just show that we are adhering to the guidelines, we're following the rules, we're being as safe as we can. Now, if or when symptoms arise and it makes sense, tests would be administered. But at this time, we're being told that it wouldn't even make sense because there could be false negatives. So we're being watched closely and everybody is doing what they're supposed to do. I just have to say that the staff from the EOC, our community health nurse, and our human services employees have been amazing with their calls and their contact, making sure we have what we need, making sure that the families have what they need, because yes, we have a family here. And we are being as diligent as we can to be safe. So I just wanted to offer these words. This is a public service announcement to make sure that you're aware that there is a potential exposure. Nothing more at this point. So, Idamia for your time. Talk to you again soon.